back, everyone. The CDC is now warning that the number of measles cases in the U.S. is at a level that hasn't been seen in decades. And just a few moments ago, we got fresh new numbers, at least 1,288 cases as of yesterday. And the last time numbers were this high was way back in 1992. The study counted cases in 38 states. CBS News medical contributor and editor-at-large for public health at KFF Health News is Dr. Celine Gounder. She joins us now with more on this. You have been warning about the lack of vaccinations in some parts of the country contributing to this. This was eliminated back in the year 2000. So what has led to this reversal almost, which seems to be, we would have thought this impossible a couple of years ago?
Yeah, Errol, just to reemphasize that, this is the highest number of cases of measles in the U.S. in over 30 years, and we're only halfway through the year. So we will likely see many more cases by the end of 2025. Measles was declared eliminated in the United States thanks to widespread use of the MMR vaccine, measles, mumps, rubella vaccine. But now what we've seen is that vaccination rates have slipped below the 95% threshold that's necessary to prevent outbreaks. What we're seeing is among kindergartners in the U.S., the average is about 92.7% coverage with MMR vaccine. And in some communities, it's quite a lot less. And so you combine that with more international travel, people bringing in measles, as well as some delays in vaccinations resulting from the pandemic years. And you really have the perfect conditions to be seeing measles outbreaks.
You know, we currently have a Health and Human Services Secretary who says, I'm not a doctor, I don't give medical advice, and has been a vaccine skeptic. And now it seems as if vaccine skepticism, as well as misinformation, can be contributing to that lower vaccine rate. Is that accurate? And if so, what parts of the country are you seeing that?
Yeah, it's really unfortunate that we are seeing mis and disinformation about vaccines, particularly coming out of the highest levels of the government now. Secretary Kennedy has long been a vaccine skeptic. He's also known to promote other myths about health. For example, promoting the myth that HIV does not cause AIDS. We know that is a false idea. He also dismissed the CDC's External Vaccine Advisory Committee recently, stocking it with people who have a history of being vaccine skeptics, who do not have expertise in infectious diseases or vaccine clinical trials. And a recent KFF poll found that over half of the U.S. Adults in the U.S. have encountered false claims about vaccines. And those who have been influenced by those claims, among those who have been influenced by those claims, about a quarter have delayed or skipped at least some vaccinations for their children. So this is having a very real impact on vaccination rates.
Wow, and that could really be the difference between getting to that 95% vaccination rate and what we're seeing now. Dr. Celine Gounder, really appreciate your reporting and your insight there. Thank you so much.